Hi everyone, my name is Kelly Santarosa. I'm a Senior Policy Analyst with AUMA. I'd like to welcome you all to the first webinar in our Healthy Futures webinar series. Our webinar today is focused on policy options for municipalities to address smoking and vaping. I've got two presenters here with me today, Kayla Atke, Policy Analyst with the Alberta Policy Coalition for Chronic Disease Prevention, and Les Hagen, Executive Director of Action on Smoking and Health. And I will turn things over to Kayla.
Great, thanks Kelly. So thanks everyone for joining us today for the webinar on smoking and vaping, policy options for municipalities. My name is Kayla Atke and I'm a policy analyst with the Alberta Policy Coalition for Chronic Disease Prevention. So as Kelly mentioned, this webinar is part of the Healthy Futures webinar series that the Policy Coalition is excited to be co-hosting with the Alberta Urban Municipalities Association and Rural Municipalities of Alberta. And we're really highlighting policy topics to improve community quality of life and well-being. And today we're focusing on the issue of smoking and vaping. The webinar today will start with a brief introduction to the Alberta Policy Coalition for Chronic Disease Prevention, and then we'll get right into a presentation by Action on Smoking and Health on municipal policy options to address youth smoking and vaping. And we'll end the presentation hopefully with some time for questions and discussion. So to get started, a bit about the Policy Coalition. We are based out of the School of Public Health at the University of Alberta, and we're co-led by Dr. Kim Rain and Dr. Candice Nikifork. The Coalition is a group of 16 organizations from across Alberta that have come together to coordinate efforts, generate evidence, and advocate for policy change. So Action on Smoking and Health is one of our organizational members, and other prominent members that you might be familiar with include Canadian Cancer Society, Heart and Stroke, Alberta Health Services, and Diabetes Canada. The objectives of the coalition are to increase the capacity of policymakers and decision makers to use policy as a strategy for chronic disease prevention, providing leadership in the development, implementation, and evaluation of policy, and facilitating various actors in coming together to enhance public acceptance of policy-related activities. Our work really focuses on addressing behavioral risk factors for chronic disease by working to promote healthy eating, active living, and focusing on tobacco reduction and alcohol-related harm. And today the webinar is really focusing in on the issue of tobacco and vaping. The work of the Policy Coalition and this webinar series really takes a policy lens. So why focus on policy? Well, we really view policy as an important tool for creating environments and settings where healthy choices are easier for individuals. And this can apply to a variety of locations, including schools, workplaces, communities, municipalities, and even the wider population as a whole. So you could think about it in terms of the province of Alberta. And creating environments and settings where healthy choices are easier in turn really works to promote opportunities for all Albertans, including the most vulnerable, to improve their health and reduce chronic disease risk. So before I pass things over for the future presentation, I just wanted to poll the audience on a few questions. So the first question is, in what ways is policy part of your work or setting? And there should be a variety of options there. Hang on. So just one moment, we're going to add some options to that poll, so just hang on here for a minute.
Sorry guys, let me try this again. Okay, sorry.
Can I move on to the second question maybe?
Yeah, go for it.
Okay, so we're going to move on to the second question, then we can go back to the first. So this question is, in what ways is policy work part of your work or setting? So we'll just take a couple of minutes and you can respond to that poll question. Okay, just a few more seconds on this one. Okay, awesome. So a lot of people saying they participate in policy advocacy, help to find evidence for policies, and contribute to policy development. So this is great. Okay, so we're going to move on to the third question, which is on a scale of 1 to 10, how would you rate your capacity? Sorry, can I? Oh, yes. On a scale of 1 to 10, how would you rate your capacity to support or influence policy on smoking and vaping in your community? And so when we're talking about capacity, we're really talking about things like skills, access to resources and supports, and commitment. So just take a moment to answer that question.
Okay. Yeah, just answer the submit button's not working? Okay.
Okay, it looks like we're having some issues with that one.
Let's go back to the first one.
So we'll go back to the first one, and Kelly will...
let me redo that poll.
Yeah. Okay, so sorry about this, everyone, but the first question is, in what ways is policy work part of your work or setting? Great, so just a couple more minutes for this one. A lot of people saying that they contribute to policy development, responsible for policy implementation, and interested but not necessarily active in the policy process. Great. Thanks, everybody. Well, I think at this point we're going to move on to the future presentation, but it's just good to kind of get a bit of a litmus test for who's in the room. So thanks, everybody, for being here today. And without further ado, I'm going to pass things on to Les Hagen from Action on Smoking and Health.
Thanks very much, Kayla. And thanks, Kelly. It's a pleasure to be here.
Sorry about the polls, guys.
Kelly's working feverishly here, and it's wonderful. We've got a great setup, and happy to be a part of this, and for the leadership from Alberta Urban Municipalities Association and the Alberta Policy Coalition for Chronic Disease Prevention, and for their willingness to provide us with this opportunity to focus on smoking and vaping, a very high-profile issue right now, particularly youth vaping. So I'm going to start here with just a quick overview of ASH and what we do. And ASH is one of Canada's longest-serving tobacco control organizations. We've been around for a few decades, and we set up the first full-time shop on tobacco control west of Toronto. That was back in 1989. So over the years, we've been providing local, provincial, national, and even global leadership on tobacco control. One of the, we've had a number of achievements. One of the more recent global achievements was to support the development of the world's first ban on flavored tobacco, which started right here in Alberta in 2013 with the passage of the Tobacco and Smoking Reduction Act. So we've been quite active over the years, but we've also been working very diligently in our own backyard in Alberta and with Alberta municipalities, and we've been able to achieve some good things. So what's the big deal about tobacco? Well, it is the leading avoidable cause of premature death in Canada and, in fact, in the industrialized world. And here in Canada, 38,000 deaths annually, which is more than all other forms of substance abuse combined. $12 billion is the annual impact on the Canadian economy. About half of that is healthcare costs. The other half is reduced productivity. So employers can certainly understand the impact of tobacco use and its contribution to absenteeism and sick leave and long-term, short-term disability and even premature death. So it really affects us all in some way or another. And we all know people that have been affected by tobacco use, including nicotine addiction. And of course, non-smokers are also affected. So it's not just about the people who use the product. Tobacco is a unique consumer substance, consumer product. It is uniquely deadly and harmful. It has no safe level of consumption. We all know that it's highly addictive and that it is the most widespread and deadly form of substance abuse. In fact, it kills more Canadians than all other forms of substance abuse combined, and that includes alcohol. And here's the real clincher. The only consumer product that kills 1/2 of its users when used exactly as intended. So that's quite a death rate, an exceptionally high death rate. Imagine if half of all people who drive were dying on the roads. The speed limit would be 20 kilometers an hour, right? I mean, when you think of the rate of death, it is high, exceptionally high with tobacco. Now we've got this, youth and tobacco is a big focus for ASH, and kids are easily hooked. We know that too. In fact, just a few cigarettes smoked in a row is often enough to get a young person hooked for life. And once they're in the nicotine trap, it's very hard to get out. Nicotine addiction is a chronically relapsing illness. It takes most smokers several attempts to try. Many never do. Think of Barb Tarbox, who's on millions of cigarette packages. She smoked right to her death. She wanted to quit desperately, and she could not. And that's the kind of grasp it has on millions of Canadians. So the latest stats we have, these came out just before Christmas in the Canadian Student Tobacco and Drug Survey. It's done every 2 years. And in that survey, 166,000 youth in grades 6 to 12 across Canada were estimated to have used tobacco within the past 30 days. And you know what? That is exactly 166,000 too many. And 80% of smokers are addicted by the age of 18. So nicotine addiction is also, tobacco dependency is also called a pediatric illness because 80% are addicted by the age of 18. So the solution to addressing the overall tobacco problem is getting kids not to start and protecting kids from tobacco and nicotine addiction. And to this very day, the tobacco companies continue to target youth with price discounts and promotions. Just within the last week, plain packaging has come into effect in Canada. So for many decades leading up to the last week, tobacco companies were using colorful, interesting packaging and slim packs and slim cigarettes and everything else to get kids' attention. So that's gone, fortunately. The slim cigarettes are gone in Canada as well as of last week. That's a big plus, especially for those who have concerns about weight control and who identified slim cigarettes as a means of controlling weight. And flavored tobacco. Now, that trend started here in Alberta. We're very proud of that. We now have a national ban on menthol cigarettes and most forms of flavored tobacco. There still are some exemptions, and we've got to close those loopholes, including flavored shisha tobacco, which is still allowed in Alberta and several provinces. But the industry is still doing whatever it can to target kids. And now we're going to talk about youth and vaping. And vaping and tobacco share the same fundamental health risk. And it's not lung disease. It is nicotine addiction. Nicotine addiction is an illness. Physicians can bill in Alberta and other provinces for helping people to treat nicotine addiction. And it is a physiological illness, but because it's an addiction, it's also a psychological illness. So those characteristics make it very hard to treat. And look at the number here. This is the explosive rise in youth vaping. We now have 400,000 kids vaping in Canada who have vaped in the past 30 days. They are all risking nicotine addiction. And we know that vaping is not harmless. For those who are smoking, it is potentially a means of quitting. For everyone else, it's not harmless. It's harmful. And the biggest risk is nicotine addiction. And we know, too, that kids are being targeted big time by the likes of Juul and Vape and Logic and others with alluring, high-nicotine flavored stealth devices. And the Juul product in particular, what they've done is they've married basically the allure of an iPhone with that of an e-cigarette. And they've created a product that is just flying off the shelves, and that kids are across North America, throughout the world, are getting their hands on. Did I just skip a slide? No. Okay. So why the concern? Obviously nicotine addiction, and it's a huge risk factor for tobacco initiation. In fact, kids who vape are 4 times as likely to become smokers themselves. So, we can't have kids playing with nicotine, especially 400,000 kids. We also face the possible renormalization of smoking. And to a 5-year-old, whether someone's smoking or vaping, it really doesn't matter. They see someone as smoking. That's what they identify. And the more depictions that a young person sees of smoking, and especially as they're growing up, the more likely they are to become smokers themselves. So that's why we have to be concerned about people vaping outdoors. Not necessarily because the vaping itself is causing harm, but kids are witnessing what is the equivalent of smoking in public places, despite all the efforts we've made collectively, including many of the people on this call, to create smoke-free communities across this country. There are other health hazards of vaping in addition to nicotine addiction, but nicotine addiction cannot be downplayed. And I'll get into what some of those other health hazards are. And then, of course, right now there are some very significant regulatory inconsistencies between the way tobacco and vaping products are regulated, and those consistencies need to be reduced. So, I mentioned that vaping companies are aggressively targeting kids. They are indeed sponsoring things like clouding competitions and promoting vape tricks and contests that involve these vape tricks. And, it's alluring, it's cool, it's sophisticated. How it'd be hard for a young person not to be attracted to that kind of activity, in my opinion. Here are the stats for Canada and Alberta for the last 4 years for youth vaping. And you can see there's been an explosive rise in youth vaping. And 3 to 4 times, in fact, increase since it was first measured in 2014, 2015. So within a 4-year period, we've seen 300 to 400% increases in youth vaping in Canada and Alberta. And there's lots of interplay between smoking and vaping. In fact, most vapors are also using cigarettes. So especially youth. So it's not being used as a means to quit by youth. It's a means of initiation. And in many cases, vaping is leading to tobacco use. And that's a huge concern. The products like Juul, Vape, and Logic, the cartridge products, we call them stealth vaping products because they're easy to conceal. And they also have very high levels of nicotine. In fact, a formulation of nicotine called nicotine salts, which is much more readily absorbed in the bloodstream and therefore much more addictive. As I mentioned, the Juul is really the iPhone of vaping, and it's created quite a trend, a disturbing trend, and that's why everyone else is getting on board, including tobacco companies like Imperial Tobacco and JTI McDonald. But 1/3 of Juul is now owned by Philip Morris. So all the big tobacco companies are in the game, and all the big tobacco companies are quickly repositioning themselves as nicotine companies so that they can cover both sides of the market. Now, what they will tell you is that, well, when people transition from tobacco, at least they've got nicotine, and nicotine itself is a lot less harmful than smoking. But what they don't tell you, but what they are telling their shareholders in their annual reports, is that the vaping market, in fact, is not replacing the smoking market. It's adding to the smoking market. So they are actually building customers. They're not losing them, and customers are not switching en masse to vaping products. So the bottom point there, that's a new study, which was a modeling exercise showing that for every smoker who quits smoking with vaping, there are 80 kids who will start smoking, 80 youth vapors who will start smoking for every smoker who quits with vaping. So from a public health perspective, those aren't good odds. That's not an effective harm reduction strategy. So again, we're back to nicotine addiction. You really can't get away from it if we talk about the health risks in vaping. It's front and center, although people, even health organizations, I noticed, tend to skip over that very obvious fact that needs to be restated. But there are other health risks as well. Nicotine poisoning is one, especially with the liquids that are out there. So, imagine a child seeing a purple or orange bottle of something, and it's got candy on the front of it, or images of fruit on the front of it. Of course, they're going to be attracted to that, and it is leading to nicotine poisoning. And nicotine is very poisonous as well. Just a drop of nicotine on your tongue will kill you. It's a very harmful substance. It exists in tobacco and vaping products in very trace amounts, but enough to cause addiction. It can alter brain development. It's a risk factor for tobacco dependency. I think that's probably the biggest risk factor. You've heard of things like popcorn lung, which causes permanent lung damage. There's a particular flavoring additive called diacetyl that gives these products a buttery, creamy flavor, and that has been associated with a condition called popcorn lung, which is permanent lung damage. And there's a new study out just before Christmas. A new longitudinal study came out showing that vaping is indeed a risk factor for respiratory illness, including asthma, chronic bronchitis, and COPD. In fact, vapors, according to the study, are 3 times as likely to contract lung illness as non-smokers. And when you combine that with smoking, which this study did, the risks go up even higher. But the bottom line with vaping, you'll hear people say, people who don't want to take action, you'll hear them say, well, let's wait for another study. Let's wait for another report. No. We know it causes nicotine addiction. We know nicotine addiction is harmful. We know nicotine addiction leads to tobacco dependency. We know we've got 400,000 kids using vaping. No, we do not need another study. We can act right now, and we should be compelled to act right now. Here's another hazard of vaping, the injury. This kid is from Lethbridge. This happened a couple of years ago where a vaping device exploded in his face. and he ended up with second-degree burns. Fortunately, he was wearing glasses, or he could have been blinded. So that very serious injury. And this is not uncommon. So here's the anatomy of the various vaping devices that are out there. There are cartridges, there are tanks, there are cig-alikes. The cartridges, as I mentioned, are generally high nicotine formulations that we call stealth devices. The liquid devices, I like to call them fog machines, because that's essentially what they are. They, like a fog machine, they involve glycerin and water and heat, and that's exactly what a fog machine is. And but you know, of course, the vaping companies add flavorings and other chemicals to make them more appealing and more palatable. But think of it as a fog machine, and that's why we have these vaping and fogging and clouding competitions. It's a fog machine with nicotine. So the federal government took some action in May of 2018. They passed a new bill. They actually amended the Tobacco Act, which is now the Tobacco and Vaping Products Act, and with the objective of providing a balance between protecting youth from nicotine addiction and tobacco use while allowing adults to legally access vaping products. And they've already admitted that the federal government, they got that wrong. And in fact, it had the effect of rolling out the red carpet for Juul. Juul had already had a strong presence in the U.S. prior to 2018, and boy, did they ever come on strong in Canada after this act was passed. Before this act was passed, vaping was kind of in regulatory limbo in Canada. Health Canada had a standing order, in effect, that nicotine vaping devices were prohibited, but the order was not enforced. So these products were appearing all over the country. This act legalized vaping products and put controls on vaping products, but not enough. And I'll get into that. Really, the end effect was just letting the vaping horses out of the barn, and with Juul and other companies basically running at full speed toward our kids. So, but, you know, people make mistakes, governments make mistakes. Now let's fix those mistakes. Here's what the Act currently prohibits. Sales to youth under the age of 18, so that aligns with tobacco. Advertising appealing to youth, well, that's subject to everyone's interpretation, including lawyers with the federal government, and tobacco industry lawyers as well. Lifestyle advertising, again, that's subject to interpretation. And it seems like the interpretation for lifestyle advertising for vaping products is a lot more liberal than the definition for lifestyle advertising for tobacco products. So there's some inconsistency in the application of that ban as well. There is a standing sponsorship promotion, and that's a good thing. And there is a ban on giveaways of vaping products or branded merchandise. But these things are still allowed in bars, and are still happening in bars. And a lot of youth end up in bars, maybe some of them when they're over the age of 18, or most of them, but not all of them. So here are all the exemptions in the Federal Act. Advertising that does not depict people. Okay, so, well, that's a start, but that doesn't address all forms of lifestyle promotion. You know, what about a cartoon character, for example? Is that not a lifestyle promotion? What about, depicting a sport or an activity that's appealing to kids that doesn't involve any people, but just the equipment itself or what have you, or the surroundings? Retail displays and promotions are exempted currently. There are no federal restrictions on public vaping. And there are no restrictions on flavors and nicotine content or online sales. And online sales is a huge issue. Now, here are some of the ads that we saw after this act was passed, not before. These ads were prohibited before the Tobacco and Vaping Products Act was brought into place, but were allowed thereafter. And for several months, these ads flooded the airwaves in Canada, primetime television. And if you miss them, it's just because you've already switched over to the streaming. Yeah. And here are some of the social media advertising. And the vaping companies this is the predominant form of advertising for vaping companies. And social media advertising reaches kids big time. Facebook, YouTube, Instagram, high reach for youth. And kids live on social media, as we all know. And they are getting these ads and seeing these ads. Retail promotions. Again, youth frequent retail stores. And they can see these ads and promotions and displays, which are still allowed in most provinces and still allowed under federal legislation. Here are the retail displays. We banned the retail display of tobacco products because of exposure, because we were concerned about kids. And it's rated children. These are rated children's eye level, right beside all the chocolate bars and candy. There's no excuse for allowing these companies to display their products beside tobacco and candy and to make them visible and accessible to young people. Now, for the record, the health organizations involved with tobacco control across Canada, we warned Health Canada. We warned the federal government that this was all going to happen if the bill was passed as introduced. So we were very concerned, especially with television advertising and social media. Prior to this bill being passed, tobacco companies hadn't been advertising in Canada on television for almost 50 years. So the regulatory climate has been severely compromised. Now, the federal government has recognized that the bill doesn't go far enough, and it's bringing new regulations forward to control point-of-sale advertising, including the power walls and displays, to address advertising in public places, including retail settings, broadcast, TV, radio, print advertising, social media as well, which is a little tougher to control, but there are ways. There are new health messages coming out, and I guess I already mentioned retail displays. So just in December, we do have draft regulations coming forward to address these issues. And then earlier last year, the minister started a consultation on regulations for nicotine concentrations, flavorings, and online sales. So we are expecting to see draft regulations on some of these items as well. However, despite all the announcements which started January of last year, we have yet to see a single regulation. Like, the regulations take time, especially at the federal level. The federal government could accelerate all of this just by a few amendments to the Act, such as aligning all of the restrictions on tobacco with those on vaping. They could do that in one legislative session, but they have not. So the provinces, of course, have a role to play as well. Health is a shared jurisdiction, and tobacco is a shared jurisdiction. And most provinces have actually acted on vaping. In fact, every single one except Alberta. But Alberta conducted a review of its Tobacco Act, a mandatory review last fall. Kayla and I and others participated in that review. And We are anticipating the results with recommendations to be released within the next week or two, well, soon, by the MLA who chaired that review, MLA Jeremy Nixon. The review itself was authorized by the Minister of Health, and with a view to address vaping, in addition to bringing in, hopefully, further restrictions on tobacco use as well, because we only get an opportunity every 5 years to do that. So far, Nova Scotia and PEI have gone the furthest in terms of regulating nicotine or vaping and vaping promotions. In fact, they have both banned. They are banning flavors in all vaping products. So that's a great first step. PEI is also increasing the minimum age of sales for tobacco and vaping to age 21. A number of provinces, including BC, are also looking at, or will also be setting nicotine levels, maximum nicotine levels on vaping products. So, Alberta's behind, unfortunately, but now we've got the ability to look at what other provinces have done and to pick the best elements of all of these laws and to put them into one meaningful, comprehensive law that will adequately protect Alberta kids. By the way, I know we've got people on the call outside of Alberta as well, so try not to be too Alberta-centric. Here's a more graphic breakdown of provincial legislation across Canada. I should also mention, not only have PEI and Nova Scotia moved to ban flavors, but we have several U.S. states, a growing number of U.S. states, including Montana, Washington, and Oregon, that are banning flavors, have banned flavors in vaping products. And we know that flavors are a huge driver when it comes to youth vaping and starting to vape and the attraction of vaping. Provincial omissions, that's here in Alberta on smoking and vaping. Now we're going to transition a bit into smoking and vaping, which is the theme here. And you can see there are a number of gaps, and we are dealing with cannabis, shisha, vaping. We're dealing with all of these things independently in different ways. And Ash is saying, no, we should be dealing with them in a more consistent format, especially if the goal here is to prevent modeling among youth. This is just another chart showing the gaps and inconsistencies between how we control smoking and vaping in indoor settings and outdoor settings in Alberta. And the chart would look similar in other provinces when you break it down. You can see that there are more controls on cannabis smoking and vaping than on tobacco or nicotine vaping. So part of this game is just to kind of line things up. Even if we just lined up with cannabis, we'd be one step ahead right now, which is another legal product. So the Alberta government launched this review, as I mentioned. We are expecting recommendations any day. We are anticipating legislation this spring, hopefully strong legislation. This is a poll that was commissioned by the Campaign for a Smoke-Free Alberta. By the way, I got to put in a plug for the Campaign for a Smoke-Free Alberta. Ash is a member. It is our provincial coalition on tobacco use. And it includes many of the players that are involved with Kayla's coalition, including the Lung Association, Heart and Stroke, the Cancer Society, Alberta Public Health Association, Alberta Blue Cross, Alberta Health Services, and others. So we are working collaboratively. And this is a poll we commissioned from Leger Marketing, Leger Research, back in the fall. Just Albertans' opinions on various regulatory measures on vaping. And on the point of aligning restrictions on vaping with those that already exist on tobacco, 88% support. So that number is so high, that would actually extend into people who are smoking and vaping, who believe that we should be aligning the restrictions on vaping products with those on tobacco. And then should be taxed like vaping, like tobacco products again, 80% plus, 80+% support, and vaping should be prohibited everywhere smoking is prohibited, 85% support. And all flavors should be banned. Well, 2 out of 3 Albertans think that all flavors should be banned. And those were about the same numbers we were getting on tobacco that were enough to justify a flavor ban on tobacco. So the public is with us, and governments just have to get after it. Now we're going to talk about municipalities, because we can't let you guys off the hook. And municipalities have long been involved with this issue. And before we had provincial laws on smoking, we had municipal bylaws on smoking and on vaping. Red Deer was one of the first jurisdictions in Canada to regulate e-cigarettes and the use of e-cigarettes in indoor and outdoor public places. So, municipalities have a role to play, and under the Municipal Government Act, you also have a duty to look after the health and welfare of your residents. Some simple bylaws, simple measures like prohibiting smoking and vaping of anything in all public places frequented by youth, that would be a very good first step. And we have, I've got a list, next slide I think, of about 15 or 16 municipalities in Alberta that have already done that. Municipalities can license and regulate vaping retailers. Several municipalities in Alberta, including Edmonton and Calgary, St. Albert, Lloydminster, a few others, I think Tabor, there's a few others that already license tobacco retailers. Well, they could also license vaping retailers and charge them some fees and recoup some of the enforcement and administrative costs. If a municipality can charge $1,500 for a cannabis store or higher, they can certainly charge the same fees for tobacco. Tobacco kills almost 50 times as many Canadians as cannabis. So in creating licensing for vaping stores or retail stores that sell vaping and tobacco products, you can also attach conditions to those licenses. Like you can say there shall be no in-store promotions, or that there shall be no flavored tobacco or vaping products sold. These are conditions that you can create, or different levels of licensing. So if you're going to sell flavored vaping products, you have to pay twice the fee. Lloydminster already does that with tobacco products. They charge $800 to tobacco retailers for an annual license, $1,200 if they sell flavored tobacco, any form of flavored tobacco. So there's some interesting and clever things municipalities can do, and some of them are even revenue opportunities. And of course, the municipalities often have a say in what your local police are doing. And some of you have your own police departments. Well, you can encourage your police departments to actively enforce local and provincial laws on vaping and tobacco, because any peace officer can enforce these laws. And in Alberta, we even have a ticketing process under our provincial tobacco law. So it's very simple, very easy for the police to get involved in. And your bylaw officers too. Many bylaw officers have peace officer status. So any peace officer can enforce the Provincial Tobacco Act. It's not a criminal matter. And of course, municipalities can, and many are, urging the federal and provincial governments to take action. You all go to the same events. I know you do. I see you there. MPs, MLAs, members of parliament, and I see you talking about different priorities, and you should all, when the opportunity arises to discuss this issue with your member of parliament or your MLA, please do. That would help, and we appreciate your help. In fact, they might even take you more seriously than they take us. So, every little bit helps. They know what we're going to say. Of course, we're going to say get rid of vaping and tobacco. But for them to hear it from other policymakers can have a heck of an impact. So here are the Alberta municipalities that have addressed smoking and vaping. And most of these have actually received Smoke-Free Spaces awards from ASH and its partners for adopting gold standard bylaws. And a gold standard bylaw is essentially a bylaw that prohibits the smoking or vaping of anything in public areas frequented by kids. This would include public events, parks, playgrounds, recreation spaces and facilities. Most of these municipalities have already done this. So there's lots of leadership, lots of examples. Oh, did I skip? No, okay. This is the ASH model smoking bylaw, and we can get that out to all of you. Kelly,
yeah, for sure.
Facilitate that, thank you. And it provides a broad definition of smoking that captures anything that can be smoked or vaped, including anything that might be introduced in the future. The restrictions extend to parks, public events, playgrounds, sports fields, outdoor facilities, and amusements. It also calls for a smoking ban in hotel and motel rooms. That's an exemption in the Provincial Act. But people work. Hospitality workers, people work in hotels and motels. They deserve to be protected too. Hospitality workers don't have second-class lungs. There's no allowance for smoking rooms in our model bylaw because smoking rooms don't work. There's basically no level of ventilation that removes that completely removes secondhand smoke. And our bylaws, of course, this bylaw can be enforced by bylaw officers or police peace officers, as any municipal bylaw can be. The other thing I should say about our model bylaws is it's intended to reduce youth modeling and to create a non-smoking norm. The indoor bans dealt mainly with protecting non-smokers. We've moved beyond that now. It's about preventing modeling to kids, creating a non-smoking norm, and doing everything we can as governments and as a society to keep kids tobacco and nicotine free. That's what this is all about. And when it comes to modeling, it's monkey see, monkey do. I mean, kids, modeling is an essential element of childhood development. If we model healthy behaviors, we're more likely to get healthy kids. And every time kids see smoking in public, that's another cue that smoking is socially acceptable and is safe, or must be somewhat safe, or it wouldn't be allowed to begin with, right? That's the kind of implied message that kids are getting over and over and over again. So ASH has also set up a municipal resource hub, and we've got some new funding from Health Canada to expand all of this great Alberta work to all the 4 Western provinces. And we're really excited about that. I've got new staff in all the 4 provincial capitals. I think they're even on this call and or on this webinar. And we're really excited because the great work we've been doing here in Alberta to help municipalities over the past few years, well, for a long time, but we've had a real concentrated effort over the past few years that's been supported by Alberta Health Services. Well, we're now extending all of that activity and outreach to all of the 4 Western provinces. So very soon, we're going to have a new website with resource hubs, policy hubs for every single province. And with the policy charts for every province and model bylaws and various resources. So and we're going to be engaging in a number of outreach activities. So you'll be hearing from us. And this is one example of that outreach effort. But you're also very welcome to call us and contact us. I'll give you a number at the end here. Oh, yeah, okay. These are some of the charts, municipal charts. We will have these for every single province. This is a breakdown of the bylaws in various municipalities across Alberta. And, yeah, that's it. So thank you all very much, and it's been a pleasure. Back to you, Kelly.
Great, thank you, Les. So In addition to the resources that Les has pointed out, I also just want to highlight a couple of the resources that the Policy Coalition has available. So on our website, we have a resource hub with a variety of resources to support your policy change efforts. So one of our resources is the Policy Readiness Tool, which is designed to help assess your community's readiness for policy change and also determine targeted strategies for taking action. We also have a model for community capacity building, which outlines stages in the community capacity building process. And then finally, we have a resource hub with policy templates, tools, and resources. But definitely for the area of tobacco and vaping, Action on Smoking and Health Resource Hub would definitely be the go-to resource for that. And then just to end the presentation, just sharing a quote from a former coalition policy analyst that always seems very relevant to our work, especially in the field of public health. So public health is policy work is a long road which requires a sustained effort. It's often about small incremental changes and successes, but when it all comes together, the positive impact for the population as a whole is well worth the effort. So just a little bit of motivation for you wherever you are on your policy journey.
Policy journey, I like that.
And if you are interested in any of our resources or want to find out more about the coalition, here's our website. You can also email me with any questions and our Twitter handle. And then, before we move on to questions, let's just try that polling question again. So following the presentation, we're just interested in on a scale of 1 to 10, how would you rate your capacity to support or influence policy on tobacco and vaping?
You know what? And see, this only gives one option now. I mean, I can put in the one with 10 again, but then this is...
That's okay. So we'll be sending out actually a post-webinar evaluation. So I encourage you to fill that out and share with us your thoughts on where you're at in terms of capacity for policy change and how we might be able to support your efforts.
And I will figure this out for the next webinar. Okay, so we do have a number of questions. And we'll kind of go through them, starting with the ones that were entered first. I'm going to read them out loud, not because I think that you guys can't read, but because we are recording the webinar, and it'll be easier for people who listen to it afterwards if they know what the question is that we're answering. So the first question, in recent conversations, people have raised the issue of vaping as a means of cessation. Is there any evidence for that?
Well, there is some evidence, but it's disappointing evidence because it's actually not as effective as people would hope. And then we also have to consider that there are kids who start smoking because they are become addicted to nicotine from vaping. And that study I pointed to shows that for every smoker who quits successfully with vaping, there are 80 kids who start smoking from vaping. So from a public health perspective, that's not a good trade-off.
Yeah, and I guess, I mean, maybe they stop smoking cigarettes, but they're not actually breaking their nicotine addiction.
Yeah, I mean, we know that nicotine replacement is an effective means of quitting, but it should be combined with counseling. And in the case of vaping, the vaping products aren't regulated like the other nicotine products are. They're not medical products. So there are other forms of nicotine, including inhalers and the patch and the gum, that are safer, more reliable.
So there were a couple of questions just about the references from some of the stats. So the one that you just mentioned, the study of the 80 kids that will start smoking. Also, the kids who vape risk nicotine addiction and are 4 times more likely to start smoking, and that there's 400,000 youth vapers in Canada. So there's just a couple of people wondering what studies those stats came from.
We can send those out.
Okay, sure. Note here. So yeah, we'll send that links to those studies out too. along with the recording and the slides and the link to the model bylaw. So that'll all go out in our newsletters. Okay, the next question. So perhaps, or more of a comment, perhaps I misunderstood. I thought that the TVPA, the Tobacco Vaping Prevention Act, prohibited specific flavors, so Schedule 3, flavors like confectionery and desserts, but the compliance with this is compromised.
Good question. If there are existing restrictions, they certainly aren't being complied with in any meaningful way.
Okay. This is looking at school policies. There's a bit of a discussion around this. So there's a question about, are there any school policies already in place that address students found vaping in classrooms and bathrooms? So a couple of people commented that Buffalo Trail Public School Division and East Central Catholic School Division had policies on this. Also that it's different from division to division, and some school boards treat it as any prohibited substance. But I think there's a comment that educators are frustrated by not having policies, and some teachers will just confiscate the vape pens, which is problematic. And then Jennifer says, health units can help support school boards that are interested in updating their policies if they'd like to more explicitly address vaping. I've found most schools confiscate the vapes, which technically is taking away property of youth that they don't have the right to do, and then they can't give the vapes back to the youth at the end of the school day. Do you have any comments for anyone looking for maybe school board policies that they can use as a model?
We also have a model school board policy.
Perfect.
So people can just contact ASH. And when it comes, I know the schools are really struggling with this issue right now, and kids are getting suspended and things are being confiscated and whatnot. One thing to keep in mind, this is an addiction. This, and it should be treated as such. These kids are not criminals. They have been, unfortunately, playing with the wrong substance, which has been promoted to them, and which society has allowed to be promoted to them. So kids, if they're caught with vaping pens, vaping equipment, they should be treated, it shouldn't be just a punitive type of response. There should be some counseling and involved and perhaps some treatment involved with it as well.
Okay. There's just a comment saying that the restrictions around the flavors might be from the Cannabis Act and not the Tobacco and Vaping Prevention Act. So.
Yeah, I should know. It's a good question. You're stumping me. Good one. I should be able to answer that right away, but it's one of those things I'll have to go back to the office and double check on that.
Next question. With the brain not fully developing until 25, why doesn't Canada change alcohol and tobacco, access legalization until much later to protect youth? Youth exposure early can lead to long-term usage and misuse as an adult.
Well, there is a move to increase the minimum age to 21. And in fact, the Trump government did that just before Christmas. So right now in the U.S., you have to be 21 to purchase tobacco or vapes. Yeah. And in Canada, PEI just did that. So, 21 is a little closer to 25, and that would be a step in the right direction, in my opinion.
Yeah, I remember that conversation when they were first doing the cannabis legalization in Alberta, and a lot of people, public health really wanted it as high as 25, and there's a big discussion around what the appropriate age should be. And I think the province justified 18 by saying, well, that's the age when we let people vote, that's the age when we let people enlist in the military. That's the age at which we say they're capable of making decisions as an adult.
I think the whole part of that was the biggest focus.
Yeah, it was.
I think governments wanted those votes.
Yeah. But then I think, too, if you're going to say it's 18, you should probably invest a lot more funding in public education around the risks. Because like you were saying with vaping, with the substances not being regulated and not knowing what's in the vape liquid, you're saying that this is a safe alternative to smoking, and it's not. So. Yeah.
And even if, right now we've got a minimum age of 18, that's not adequately enforced.
Yeah.
So, you know, this isn't a simple question, because we have to enforce what we already have properly, and then we can consider moving that age up.
Yeah. Okay. So Tanya had a question about the charts for the municipal bylaws that you have for Alberta. Just wondering when those would be available for other provinces.
Hopefully by the end of March.
Excellent.
Soon.
And those would be on the ASH website?
Correct.
Okay, great. And we have, okay, so Jennifer's found the law, that it is the Tobacco and Vaping Prevention Act, and Schedule 3 of it does restrict flavors. So I think that's clearly a big gap in enforcement. But like you were saying, if municipalities wanted to deal with that, they could make that as part of the condition of licensing.
Correct.
The store, and then enforce and make sure that they're not selling those flavors, right? Yeah.
Or even a staggered fee. So you could say the license fee for stores that don't sell flavored products is $100. The one for those who do is $2,000.
It's a neat little solution. Okay, does anyone else have any comments or questions? We'll just give you a couple minutes to type them in if you do. Okay, not seeing any, so I'll just go to the next slide for upcoming events. So we do have 3 more webinars in our Healthy Future series. You can register for the one on March 13th, and we'll send out the link for registration again with everything else we're sending out next week. We have AUMA Spring Municipal Leaders Caucus coming up, and a public risk conference as well. And yeah, I'd like to thank everyone that joined us on the call, and Kayla and Les for being here and presenting. We really like these opportunities to kind of engage with you. It's easy. You don't have to travel. We don't have to travel. And yeah, did you guys have any closing comments?
No, I think that's everything. Thanks, everyone. And again, the next webinar is on March 13th, and the Alberta Public Health Association will be presenting on health in all policies and the role for municipalities.
Okay, great. Talk to you guys later.
Thank you. Please stand by.